hair loss.
Yes. Well, it's about the question, why is my hair falling out?
Why is my hair falling out?
Yes,
we get that one daily.
We get that one multiple times a day. I think behind, I'm tired. Probably my hair is falling out in clumps.
What about I'm tired of my hair falling out?
Well,
we get that one
too.
We get that one too.
We really do. So it is something that we hear all the time.
There's a genetic piece to this.
There
which is usually the case most times. But we kind of understand that one, right? What would be a reason that someone would be having? I guess it also could vary between male and female. There are different reasons. So
even females, though, have female pattern baldness as well. Now, when it runs in the family, that's definitely your number one reason for your hair to thin. Although most people that come to us, it usually is a problem because they know it's not normal for them. It might not be normal for their family. It might not be what they're used to. And we have people come in that they've collected their hair from the drain to show you. I have a lot of people bring in baggies.
Does that matter?
Yeah, I mean, they do. They show, look, I'm not just losing regular hair. Everybody loses strands of hair every day. That's normal. When you get a whole glob and it's doing it repetitively, then it's like, okay, something's wrong.
What is the first step? How do you figure out what's causing this?
Well, I mean, honestly, first thing you do is take a good history. Okay, talk to the people because they could tell you, well, I've been on antibiotic therapy for whatever, and sometimes, and that's a good indicator that can do the trick for you. And then other things, other illnesses they may have, other things they may be experiencing, how they feel. Then we typically say, okay, let's do a little lab work.
Yeah, the lab work's going to really tell you.
Yeah.
But if it is antibiotics, now that's one that it is known to deplete biotin. And a lot of people that have come in have already tried biotin because that's one thing for hair. And they're like, I've already taken biotin and it's not working. Now, if somebody has not taken biotin and they've been on antibiotics, even if it was 2 months earlier, then that's one of the first steps is let's try some biotin and see what happens. Because biotin is very easy, inexpensive. We have it by itself in 8,000, each pill is 8,000 micrograms. We also have it in our hair, skin, and nails, which for 2 pills is 5,000. So we tell people start there, and then if we don't see a difference now, if they haven't taken antibiotics, it's actually probably unlikely to have a biotin deficiency.
Yeah, that's the one most people know. They know biotin, but I was surprised to learn that it was depleted by antibiotics. So that's interesting. It always starts with an assessment. So we want to see what's going on with the particular patient. Now, we have seen a significant uptick, I think, in hair loss with people losing weight very quickly over the last few years.
Well, yeah.
So protein is, definitely a factor for a lot of people, but not everything.
Well, I like to kind of explain it to you. Your hair is really not that important to the brain. The brain says, hey, I got to keep everything working.
I am living proof of that.
You're living proof, right? There you go. And so, the brain says, okay, if I need protein to heal, or if I need this or that or the other nutrients and so on for healing processes, that kind of stuff going on, or to keep you going, then it's going to do that. And they really don't care about your hair.
Hair is actually not necessary. I mean, that is not what most people think, but that is the truth. Yeah.
It's not necessary,
not
right?
necessary.
Yeah. This is dead now. The follicle is very much alive and has many different systems that interact with it.
Right.
But
that's why so many things can affect it.
Right.
And so after that, lab work is no doubt the best way for you to tell what's going on with your hair. When you start looking at, whether it is a hormonal issue, whether it's a protein issue, whether it's deficiency in nutrients, there are so many things, and even if it's stress. And of course, all of our panels also check stress hormone because stress can actually do it. There's so many things that can actually, when you start looking at the list on what can affect hair loss, pretty much everything. It is.
Look, prepare yourself. If you're going in there for lab work and they start getting under the hood, you're opening yourself up to Pandora's box because that's when you're like, I'm just losing hair. I feel great. Well, you might feel great, but you're depleted. You're depleted in all these things. That's what happened to me.
Yeah.
You're insulin resistant, you're iron deficient, you need vitamin D,
you want to actually find out these things before it causes a more serious problem.
Sure.
Because the deficiencies, yes, you might first see hair loss, but after that, it might be things that start seriously going wrong where it can actually be life-threatening.
And that's not what we're looking for.
no.
Yeah.
We don't want the life-threatening.
No, we want to get things, we talk about prevention. You want to prevent first. If you do prevention, then it definitely is easier down the road.
Yeah.
It's always easier to take something to prevent or fix a deficiency before it causes problems, rather than try to reverse that problem once it's there. Because I have, over the years, for instance, I had a lady with a B12 deficiency. It had already caused optic nerve damage. So her optic nerve was damaged, and she called it her dancing eyes, because her eyes, the floor would move. And when she came to us, she had been going to somewhere for 1 year. And first thing I said is, let's do lab work. She said, you know what? I have been to like 10 different doctors and no one has done lab work. And I'm like, well, that's not good. So we did it, and her B12 deficiency was severe. Now we fixed her B12 deficiency. Her eyes did not recover, but that is one of the things that it says can be possibly non-reversible. So if you find these deficiencies before they cause that kind of problem, that's what you want.
Yeah, what are some of the things that we're doing to ourselves that might be causing the hair loss?
Well, stress. I would say that's.
Well, I don't know whether we're doing that to ourselves.
Well,
or
I mean.
Yeah, I try not to, but
At all costs, I try not to stress.
Exactly. Stress others maybe, but not me. No.
You're better at that than some people.
Yeah.
But I mean, we do see a lot of people with nutritional deficiencies.
Oh, yeah.
Again, going back to people having rapid weight loss, we're seeing a lot with patients
Oh,
on the
definitely.
GLP-1s.
Yeah.
Dietary interventions are definitely necessary.
Protein's probably one of the biggies, because the hair's got to have protein. I mean, you got to have protein to do it.
Excuse me. But when people have rapid weight loss, like you just said, or have decreased their caloric value greatly, they've also decreased their nutrients. And so when you decrease that, then you can start having hair loss. So a rapid weight loss, even if you're trying, not if it's because you're sick, can also make hair loss. And that's what you want to see when you do the lab work, or the protein levels fallen, or what are your nutrients, and see where everything is.
Right.
I think the biggest thing that we're doing is we're not looking at people's actual lab values. We see people come in and they say, I went to my OBGYN and they said, oh, you're just getting older, here's some Minidixil. They come in, we do a full lab panel, and we see where the dysfunction is before disease processes like optic nerve dysfunction, can come in. So the biggest thing is just not having enough information to figure what is happening in their body.
We should probably touch on alopecia. That's something completely different. We all kind of learned about that within the last couple years. If you remember the Academy Awards and the SMAC, we learned more kind of about alopecia, because that was what led to the comments, and it became kind of mainstream with everybody, with that going on. Everybody kind of learned about it. So let's touch on that for just a moment, because that might not be something we're doing to ourselves.
Right, that's an autoimmune issue usually. And so you can definitely have an autoimmune alopecia, and there's a few different kinds, and that is definitely a little bit different problem. It's not a nutrient problem or a hormonal issue. It is definitely an autoimmune. So that's, things like that, sometimes it is harder to treat.
Right.
Yeah.
They're not necessarily curable, but there are some things you can do to help reduce the impact.
Yeah, there is. And it's actually, it's one of the rarer things that we see. But we've had a few people come in that were diagnosed with alopecia, and you may still be able to help support and maybe not have it progress as fast, and help the immune system and things like that. So
They'll
there are
probably have
still
other
things.
symptoms.
Right, exactly. So you can still do something about it.
Sure. What are some of those specific nutrient deficiencies maybe that would cause this?
Probably number one is protein. Well, I ask every patient that comes in, and we're sitting down talking to them, especially if they mention hair. Are you eating enough protein? Oh yeah, I eat half a chicken breast a day. Probably not enough. When you look at the modern, the latest that's come out of the research on protein, and you see, and especially we see the people that, I hate to say it, as we get a little more mature, okay?
Seasoned?
Yeah.
Seasoned, that's a word, I like that. Typically speaking, that's one of the first things that they will stop eating is the protein. Maybe
It's harder to chew.
it's hard, yeah, there's a lot of reasons for it. And that's one of the most important things you can do is get that protein. Because now, they're talking about for every kilo of body weight, about 1.2, just to maintain, 1.2 grams of protein per kilo. So if you're a 150-pound person, roughly about 68 to
No, that's
70.
about 75 probably.
75, so okay, 75.
What you want to do is you want to take your weight divided by 2.2,
That's a
and
kilo.
then times 1.2. And that is your minimum. It is not that you can't eat more than that. That is your minimum.
And then we wonder how well people are absorbing their.
Well, that's it. Are they digesting or
Well,
they
that's
pulling?
that is another
Right.
thing. When you start looking into medications, are another big reason for hair loss. When you start looking, there's a lot of medications out there that hair loss is a side effect. So, and especially the acid reducers that doesn't let you absorb nutrients correctly, and then you have a lot of nutrient deficiencies.
Right.
So protein is definitely one of the big things that can do it. But when you start looking at the nutrients that we check on lab work, iron deficiency, even if your hemoglobin is normal, and I have people every single day say, oh, my doctor checked my iron. Well, they bring me their lab work. Their doctor did not check their iron. Their doctor checked their hemoglobin. And yes, if iron is extreme, yes, you might have a lower hemoglobin, but you don't have to. You can actually have enough in your bloodstream where your hemoglobin is normal, but stored iron, which is ferritin, still makes hair loss if it's low. So you got to look at that. And then B12 is a big one. B12, folic acid, vitamin D, zinc, copper. There's
Selenium.
Selenium.
Oh, yeah.
And
There's tons.
We're starting to get into like the periodic table of the elements.
Yeah.
I'm remembering some of these abbreviations.
they
now.
really do make a difference in hair loss.
So it's a really vascular system, the hair follicle. So B12 folate, that's one that is absorption is decreased with proton pump inhibitors, but ferritin is more involved in like the building process, and then we have copper that tells things where to go based on dysfunction with collagen production, and then we have zinc that kind of comes in and helps repair and build. So it's very, very intricate system, and it could be something different for everyone. We do see a lot of people taking zinc daily, and that can disrupt their copper ratios. Now, a lot of people are talking about copper peptides and all the progress that they're making with hair growth. There might still be hope. That one was just passed by the FDA.
I don't need hope. The ship has sailed. I'm good. But thank you, though.
Yeah.
But copper peptides are good for a host of things.
Yes. So they're
Skin, collagen,
Skin.
big for huge.
And that right now, I would be very happy with increasing the quality of.
the collagen.
Yeah.
So
Since it's on full display, so
Since I have no bangs to hide the other one.
right.
And Angie is getting into more of the peptides.
Yeah.
So
it's really interesting and exciting times. We can now we don't have to just work with the amino acids. They've been sequenced in a way to program them to do specific things. So it's really exciting.
And when you look at peptides, and you mentioned amino acids, people don't realize that protein is amino acids put together. So again, so important.
What about the hormonal changes?
Now, there's no doubt hormones.
The general just
Right. Everybody thinks of thyroid. Now, and that is definitely one that can make hair loss, whether it is too much or too little. I have seen people that take thyroid medicine and increase it on their own because their hair is falling out. Well, you check it and it is sky high, which is also going to make it fall out more. So it was probably too high to begin with, and then they doubled it. So don't ever change your medication without checking your thyroid, ever. Because if you go the wrong way, you're going to make it worse. And so it is a hormone.
Right.
Your cortisol, which is your stress hormone, is a hormone. And then you have your sex hormones. And there's no doubt sex hormones can also make hair loss. Even birth control pills in young girls can make hair loss. So just changing hormones either way, whether they're low or too high, can actually make a difference.
I think one of the big things we see a lot of people that are taking testosterone for whatever reason, whether it's male or female, and a lot of times we get something called dihydrotestosterone, DHT, and it's got a whole host of things that it's not very good at, and hair is one of them. I mean, if you get too much DHT versus the free testosterone, you're going to have problems. No doubt.
And there are
about it.
things to
Male or female.
block that. So, I mean, there are things to block DHT. And then when you talk about females, young females with PCOS, because they tend to have high testosterone and they have high DHT. It's not just men. So women with high DHT, due to something like PCOS or a hormonal issue, or too much testosterone replacement, which we do see that a lot too, can make hair loss as well.
Which is a big thing, especially when women are dealing with that. It's a struggle for men, but it's more of a struggle for women.
We do. We have way more women that come in very concerned about it than men.
What can you take for energy?
Probably the first thing I would tell you to take is some blood work, okay? Because you got to find out why. I mean, why do we have an energy loss, right? Are we low in whatever? Is there something wrong? Are you low in B12? Do you need iron? that kind of stuff.
Cortisol.
That's what, yeah. That's
Cortisol.
So many different-
Cortisol, yeah. That's what you have to
Thyroid.
know. Exactly.
Sleep, water.
Now there's things
Could
that
be
are,
water.
Yeah, there's supplements that are known for energy that won't hurt you. And that is like a B complex. I mean, NMN, NAD. We're seeing, especially as people age, they tend to lower the production of NAD, which is cellular energy. It turns into ATP, which is what you have to have for energy. So we do have a liposomal form of NAD. Angie does do IVs of NAD, injections of NAD. But NMN is a precursor to NAD, and we also have pills that you can take that are a precursor. So there's things like that, and then B vitamins are always good. But doing lab work is number one.
Optimal D, optimal ferritin. It's very patient specific.
Oh, iron
So-
deficiency will make extreme, and anemias.
Well, yeah.
Crazy too.
Yeah, I mean,
Well, that's why you do blood work.
Right.
What is it, you know?
we have people all the time with anemias that come in and their fatigue is their main thing. And they've already been to the doctor, and the doctor said there's no need to do lab work. And when we do it, they are like
Lab work's fine.
extreme anemia. So if you don't check it, you don't know. You cannot look at someone and tell if they're anemic or not. You cannot look at someone and tell if they have a B12 deficiency. So that is something that you cannot look. If I've had people that's brought in lab work and they've asked their doctor, did you check, how's my B12, how's my iron? And they say, oh, it's fine. And they bring me the lab work and it was never checked. So you cannot tell people that without checking it.
I mean, I wish we could.
Oh, yeah.
If we could just look at you and say, you need iron.
Yeah.
It'd be a lot easier.
Now, every
It would,
once in a while
yeah.
on iron, I can look at someone. If the white of the eye is a bluish tint, it's a sign. I still won't give somebody iron based on that. I'll still check it. But that is something that you can actually tell
That's true.
is your eyes getting a little blue.
Or they're Smurfs.
Or Smurfs, right.
Either way.
We
Right.
might,
And if your eyes get a little yellow, yellow eyes, you think about the liver. So you can tell. There's some things you can
Circles
tell.
could be ferritin or vitamin D too.
Exactly.
I've seen that.
Right.
Circles under the eyes can mean something. So
things with your
You
nails.
can look at. There's some things you can think. But I've had times where I thought something for sure, and then when you do the lab work, it is not that.
We still do, assessments and it can
Exactly.
guide our lab work, but we live in a time where we have so much technology and information, there's no reason not to check it, especially with as affordable as
Right.
we are.
I think that's the key, now with, and that's what for the past 30 years, we've worked really hard to make it affordable, accessible and affordable. You can walk in off the street, say, hey, I need to do some lab work. Okay, what's wrong? We'll assess you, find out kind of where we need to look, but it's accessible and it's very inexpensive comparatively. Promise
Yes,
you.
it is.
And
we check a lot more.
Yeah.
I mean, we do check on even I don't ever recommend any panel lower than the expanded panel. That's our lowest panel that we ever recommend. We have some people come in that their doctor wants just basic stuff. I never recommend that because it doesn't have your B12, your ferritin, your folate, your vitamin D. It doesn't have all that.
Which are the true foundational things.
Exactly. So you always want to kind of check the basics. And then we can always add zinc and copper to our panels. It's like $45 to add it. And we do see a lot of problems with zinc and copper. Copper depletes zinc and zinc depletes copper. So you can see, which one you got.
I love that you said accessible and affordable because all the things that are in our environment that are bad for us are also
accessible and affordable.
So
But we do have a lot of things that are universally good for hair growth that are accessible if people just can't do labs right now, like the micronized collagen,
Yep.
Right.
vitamin
Right.
C. We have a great protein supplement and digestive enzymes.
Right. Well, now digestive enzymes are something, gosh, I've taken those things daily.
Me too.
Not just daily, but with each meal. For God knows, I lost count way back when because I knew that was a big issue with me. And I see it with so many other people. When you talk to them, you kind of think like, okay, they got these GI problems. They're not quite right there. They've got all these signs of these nutrient deficiencies and so on. That's the number one thing.
Not
To help you
utilizing
digest your food. Right. And the ones that,
Yeah, you can take every nutrient in the world, but if you don't digest it, that's a problem.
absorption is a
And
big
absorption,
issue.
and we didn't even get into another thing that can actually make hair loss is if you have Crohn's or celiac or ulcerative colitis or all these intestinal problems that actually keep you from absorbing your nutrients.
Right.
And so at that point, you need a little bit more than digestive enzymes. We need some to heal that lining of the colon, which our GI Essentials works really well.
Right.
So that's the whole reason to come in and talk to us, because then we can figure out what it is that's causing it. Because if we don't do lab work, we really don't know for sure.
Yeah, you definitely want to come in and have that conversation
Yeah.
instead of getting online and
And another thing I didn't even mention that I see a lot of hair loss from, and people don't think about this, is pre-diabetes and diabetes. It has been known to cause hair loss, and how many people do we see that are pre-diabetic and diabetic, especially in this area?
more than not.
A lot.
Oh,
Yes,
yeah.
exactly. And people are
Vast
like,
majority.
when I tell them they're pre-diabetic and that could make their hair loss, they're like, no way. And I'm like, yeah, it can. So